So let's get into the workflow part. We all know that there are many good programs that VA puts out, and they just don't get used. And the question is why? So there are two components to that. One is that if we do not provide effective training, you don't know what that tool will do for me, how good it is. You're not going to go and find and use a tool that you know nothing about. So training deficiency that we are trying to cover through these sessions. And number two, we have not figured out how to make this tool work for me. How does it fit in with my work? Because I may have the best tools, but if I don't know how to use, then it does not do me any good. So a lot of times people will say, oh, Dr. Mavi, I know Brilliance is a great application, but it's just not working for me. And what that tells me is that the user has not figured out the efficient workflow. How do I make it fit in my work? And my work could be a nurse's work or a pharmacy or provider. So I'm just going to go over that very, very quickly. So normally this is what most of us do, most of the clinical staff, whatever your role, that we will put the patient in CPRS. Then you will greet the patient. If it's a face-to-face visit, you're going to say, hey, come on in, have a seat, just the formalities. You will look at your note, or you will look at the other relevant note saying, well, what has been going on? What's the background to this visit? So you will do that. And then you may start a new progress note, because you can start documenting at some point, and you will review, depending on what the visit is about, you will review the labs or other data which is relevant to the visit. So you have done these 5 steps. This is what we call workflow. You go from A to B to C and so on. And then you will get into the visit and you will write your note and do the remaining steps. But this is where you start. So this typically will take about 5 minutes, just the greetings and looking at the data and things like that. Let's say it just takes ballpark 5 minutes. And I have spent 5 minutes, but at this point, I know very little about the big picture on this patient. I may have looked up a few labs, I may have looked up imaging, but I know very little about this patient. And also, I do not have a clear agenda to say, well, what are my talking points? What am I supposed to cover? What are the important issues that I need to address on this visit? I don't have that yet, though I have spent my 5 minutes. Do the same thing, but do it with brilliance. So next slide, if you see, it is the same steps. Same step number 1, number 2, 3, 4, same thing, no change in your workflow. And number 5, when we come to data review, we review that data not in CPRS, but we review that data in Brilliance. So here, I'm going to come to a patient, take patient's history and say, okay, what you have, and patient may say, I have a skin rash I want you to look at, I have a joint pain I want you to talk to, and so, okay, all right. So I will come to a certain point in my greeting and my opening and say, okay, let me take a quick look about your chart and see what's going on. And at this point, I will look at Brilliance Advisories and it will tell me what the patient has. Now, you can take it one step further. Okay, just don't stop here that, oh, these are the numbers, I'm looking at the numbers. You can take this one step further and turn this into your talking points and your agenda. So what is my agenda as a provider right now? I have to address these issues, some of which may be new, which I need to do something about. Some of these are chronic and stable. I don't need to do anything about. So I will just, depending upon what I'm seeing, just say I click on cardiac event risk. So I know this cardiac event risk is pretty high. And my talking points are going to be Let's say patient is losing weight, which is good for him. We can say, hey, you are doing a great job losing the weight. Keep doing what you're doing. Then I look at my blood pressure. Let's say the blood pressure is more than it should be. And we can say, oh, your cardiac event risk is high, so we need to take better care of your blood pressure. Same thing you will do about your cholesterol, your A1C. If the patient is a diabetic, you will do the same thing about tobacco. So what you have done, you have addressed the patient's clinical issues as you go through the advisories. So you don't have to repeat that later. This is part of like your history and conversation, and this will contribute to patient satisfaction. And also the patient, you don't have to repeat this later. So as you go through the labs, and you can, depending upon what the issue may be, like say if this was a carotid stenosis and you can say, hey, you look at the data, say, yeah, somebody put in there a cerebral infarction or carotid stenosis, and you look down at the data, and when you come down and say, I don't see any carotid related imaging, and my conversation with the patient is, oh, we need to do this test. I'm going to go to CPRS and I'm going to put in an order for this test. So if this is a lab that you want to do it today, or X-ray that can be done today, or it will be scheduled for later, you just put in, and as you are talking to the patient, your work is getting done. Okay, that's the point I want to emphasize, that your work is getting done. It is not a two-part process. It's not a two-part process that I'm in CPRS and then I'm going to do to Brilliance. It is all, if once you figure out the workflow, it is all a one-step process. So by the time I get through with my advisories and anything patient will bring up in the history, say, look at my skin rash and stuff like that. So if you put that thing in the workflow as we are talking here, same, review the data in advisories, it may take you, depending on the patient, it may take you 3 minutes, 4 minutes, 5 minutes. But think about this way. In the first 10 minutes of the visit, you have covered just about everything that need to be covered as far as talking to the patient, looking at the abnormalities, informing the patient what needs to be done. And after that 10 minutes, rest of the time is mine. Okay, I can do the physical exam and address patients' concerns, do the documentation, reminders, all the usual stuff. But here, this is not an additional work. Here you are saving a lot of time once you figure out the process. And that's the reason for me bringing up this issue of the workflow, that this is how you can kind of integrate Brilliance. The information Brilliance is providing you is quite handy. You don't have to go anywhere to dig. You click on the problem. And let's say if there's an issue with the fibrosis 4 score, and we know it maybe the patient may have an issue with the alcohol abuse and things like that. That is my opportunity to talk about, hey, your liver is getting bad. We need to do something about your alcohol use and things like that. So whatever the topic may be, you can you get to see the labs if they are getting better, worse. Speak to the patient about the labs if that was important. So that's the general idea of like how you can, as you go through these advisories, and I will guarantee you that many of them you will look and say, I don't need to speak up anything on this. And that's the important thing. Do not think that you have to address each and everything. You just address what seems like important to you. And again, as a provider, your important is different than as a nurse. What's important to you may be quite different. So it all depends upon what your role is and what you are doing today. And you can just pick and choose. But in the process, you have addressed the patient's needs, concerns, and made him pretty happy that, yeah, doctor really looked at my needs. So let's move on. So once you do this process, now you have a complete understanding for your own work down the line. As far as your documentation part, your reminders part, you have a pretty good understanding as far as what's going on with this patient. And the other thing that we frequently do not even notice, I learned it from my previous boss, is about the agenda. Patient has an agenda when they come from home. So I want to talk about my prescription refills. I want to talk about my back pain. They have a clear agenda. And a lot of times we, the clinical staff, do not have a clear agenda other than knowing that, yeah, I have to take care of hypertension and diabetes. But that's not really the agenda. Your agenda is, I need to specifically address this issue or that issue. And so in the end, what happens is that the party who has the agenda, if I take over and I start talking about these clinical issues and put the emphasis where it is important from my point of view versus let the patient drive, and patient will talk to you about your back pain and more narcotics all day and you don't accomplish anything. So controlling the agenda is part of the Brilliance design, and that's something that is not apparent, it's not obvious when you look at the application, and that's why I wanted to throw in these slides.